Hello, my name is Terry Adair, and I use Invivo 3D image viewing software in my practice as an oral and maxillofacial radiologist. I first became familiar with Invivo during my residency program at the University of Florida several years ago. I now know that it is widely used by my fellow radiologists at Beam Reader's dental radiology service. Following my residency, I continued to use Invivo because I was already familiar with the many user-friendly features, and I didn't want to spend time to try to learn another viewer. Invivo is indispensable for me as a radiologist because it has so many useful tools and features. In a moment, I'm going to demonstrate a few of my favorite features that I use daily on every report. Obstructive sleep apnea and other sleep-related breathing disorders, such as snoring, have become a very big area of interest in medicine and dentistry, and Invivo's algorithm for airway analysis is first-rate. And while TMJ disorders are not new, the prevalence of CBCT machines in dental offices has become so widespread that it is now routine to image the TM joint to get an accurate assessment of the condition and position of the condyles. Invivo's TMJ imaging application is perfect for this. One of my favorite tools to use is the custom section tool, which allows the user to create a custom section from anywhere in the volume, and it can be viewed at the highest resolution of the scan. I'm going to demonstrate that feature as well as some others now. I configure the screen share. This is how the Invivo displays the scan. It's displayed in the axial, coronal, and sagittal sections. I've already created the widget here for the custom section tool along here. And this allows the user to view at an oblique angle. So this angle is created, pardon me, this image is created from this custom section tool. It allows the viewer to look perpendicular to this widget, which captures the condyle and the anterior mandible. And this is useful to determine mandibular symmetry. And using the measuring tool, I can measure from the top of one condyle to the mandibular dental midline, and now the other. And it can show that these are essentially identical. The other tools that are available is the panoramic reconstruction. This is useful because it allows the user to reformat the familiar panoramic view. The other feature is for viewing the TMJ. These widgets are created for each condyle. So now the condyle can be viewed perpendicular. So you can see the morphology of the condyle as well as its position in the fossa on both sides. The airway analysis tool, I'm going to recreate a new airway. Very simple to do. Just select the top of the epiglottis to the top of the oropharynx. And this creates not only the total volume, but it measures the minimum cross-section measurement, which is 354 in this case. You can also view 3D rendering, and this can be manipulated any way you want. In the profiles, I've continued to use Invivo viewing software because the product is so reliable and easy to learn, has endless features for every aspect of dental radiology. Plus, the support and staff are professional and friendly and available to help with any questions or issues you may have.